doctors and nurses of Reddit. What was the craziest example of someone stupidly making their condition worse? Story 1 patient here. I got an itch in my eye one night and figured my contact had dried out. I went to remove it, but the thing was stuck on my eye, so I started pinching hard trying to get it off, and then my vision went all wacky and my eye started to really hurt. Gave up and went to the ER because I couldn't see. Turns out my contact had fallen out before the whole process started, and I'd been scratching the out of my eyeball. Had to wear an eye patch and put in some very unpleasant drops for a week or two. Oops. Story 2, I was a nurse for 20 years. But this is a story about my husband. The man has a very high pain tolerance and is always hungry. So one day when I met him for lunch, I was worried when he wouldn't eat and said his lower abdomen hurt. I talked to a doctor friend, and husband was sent for immediate CT scan. Husband was sent home to wait for the results. So being him, felt better and ate 2 chili dogs with Fritos. Of course, when the doc called and told him to get to the hospital now, because his appendix was about to rupture, husband had to be kept in a holding pattern for 12 hours because had eaten a big meal. I may have shouted at husband a little bit that day. Story 3, I saw this young guy in the ER once who had gotten into a drunken brawl with some guys at a bar. When he woke up the next morning, he started getting some vision changes. He said that it was like a black sheet coming down on his left eye. This is a textbook symptom for retinal detachment. Picture an incredibly thin, delicate membrane on the back of the eye, slowly peeling off because of trauma. It's an emergency in ophthalmology because if it fully detaches, you get permanent vision loss. You basically need to immediately go for surgical repair and then be extremely careful with that eye for weeks afterward. You even have to keep your head down most of the time for the next couple days to help the reattachment process take. So naturally, this guy goes and rides roller coasters all day at the local theme park with his buddies. He first presented to our ER 2 days later with permanent vision loss in that eye. Six Flags was not worth it. Poor guy. Story 4, surgical nurse here had a patient return to the or who had some hardware plates and screws put in their elbow for a fracture. The hardware was causing them discomfort. So instead of talking to her surgeon, they decided to try and remove one of the screws with a knife and screwdriver. I got the case for the wound cleanup and replacement of said exposed screw. One of the strangest ones I've had yet. Story 5, I used to work in an oral surgeon's office. A patient came in needing a tooth pulled, and BC the root was near the jaw. They needed to remove it under anesthesia. The patient did not want to pay for the anesthesia $350, so he decided to try and take it out on his own. He used pliers or ended up breaking his jaw. We had to go and fix his jaw and wire his mouth shut. Ended up costing him $9,000 instead of $500. Story 6, Imatech. This fairly large woman came into our unit with type 2 diabetes and diabetic ulcers all over her lower legs, toe amputations, and a wound that would not heal. Her husband frequently visited her, and just before my shift brought her 6 tubs of the chocolate Pillsbury frosting icing because of her sweet tooth, and they have insulin at the hospital to match the sugar. When I stopped to check on her, she had already finished tub 4 and said to me, "But I'm already at the hospital. I might as well." SMH, yeah lady, no one ever dies at the hospital. Story 7, I had a client with a stroke who received TENS treatment in rehabilitation, really low electric impulse to stimulate muscles and nerves. After rehabilitation, he was offered to get one of the things for home use completely free of charge costs. He refuses because filling out the paper 1 page was too much work. He decided to just use what he had at home and tried using a transformator transistor for this therapy that completely destroyed the small amount of nerval function we had achieved in rehabilitation and screwed up his condition a lot. Do not try this. This hurts a lot. Story 8, not a doctor or a nurse, just the niece of a man that, after having a surgery performed on his gut and being told not to eat anything for the next 24 hours, decided to get chili cheese fries at Wendy's on his way home from the hospital. He went right back and his condition worsened. Also, my fiance's mother is a nurse and told us that a man came in once with a tiny garter snake up his urethra. It had been there for weeks before he came in because he was too embarrassed to admit he let the snake go exploring on purpose before it got stuck and died inside of him. So he promptly died of septicemia. Story 9, male patient was in for dehydration and other very routine issues. He had an indwelling catheter placed. Now, an odd thing about some men is that they cannot wrap their mind around not standing up to pee. So even though he couldn't feel any urge to urinate, he stood up to pee, felt the catheter, forgot why it was there, and promptly ripped it out. Now he's incontinent. Another patient was in recovering from surgery. I think it was knee ankle, something that required she use a walker while recovering. She decided not to do that and test her leg. She fell onto the tile floor and broke her hip. Story 10, I'm an animal nurse vet tech and had a chihuahua come in that had been limping. The owners had been giving him ibuprofen inside of pieces of chocolate. Story 11, not a doctor. but I had a stress fracture in my foot that had to be surgically corrected. I was given a 60-day supply of Vicodin, but my now ex-husband was a recovering alcoholic who had me convinced that I was going to become horribly addicted if I took them for more than a couple days. So I began taking a leave because it was stronger than Tylenol, and I only had to take one a day. My foot was very slow to heal, like a couple months go by instead of the usual 6 weeks. I had to get a CT scan, and I was very worried because this small little fracture just wasn't healing. My doctor asked what I was doing for pain, and I told him about the Aleve. Turns out NSAIDs interfere with bone healing. I cut out the Aleve, and my foot healed a few weeks later. Story 12, not a DR, but my sister and I go Christmas shopping. She's newly pregnant. I can tell she's in pain, and it's getting worse. She claims it's just gas. She thinks all stomach pain is gas. I offer to take both carts to check out while she sits for a bit. At this point, she's vomiting. I'm pretty worried and tell her I think we need to go to the hospital. She insisted it was gas, and she had a doctor's appointment the next day. So she'd mention it. Next day, she has ultrasound before OB appointment. 5 minutes and she calls me and says she doesn't know what's happening, but they told her to get dressed and not to move. She hears them call an ambulance. Ruptured ectopic pregnancy with internal bleeding. She's fine, though. Ended up pregnant again 2 months later with my nephew, but she still doesn't learn. After weeks of her sick and looking like death, I convinced her to go to her DR last week. She has pneumonia. Story 13, not a doctor or a nurse. But my sister was diagnosed with acute hemorrhagic pancreatitis when she was 16, causes shitty genes. She cannot eat anything with fats. When she was discharged after an almost 1 year stay in the hospital, she sneakily ate a small chunk of fried. We were immediately thrown back to square one. Thankful that miracles happen. Twice nursing student here. Female patient had an indwelling catheter to help void her urine. She had fluid overload from heart failure. I was at the nursing station giving my co-assigned nurse a report when I saw my patient walk up to us and start speaking to us in Greek. It took me about 2 seconds to realize that she didn't have her walker with her, another 2 seconds to notice she didn't have her catheter with her either. I walked her back to bed and saw the catheter attached to her bedpost with the balloon still fully inflated. Story 14, it was certainly a self-inflicted condition. Old guy in for rehab after some kind of orthopedic surgery, taking warfarin for DVT prophylaxis. His INR, a clotting time test, basically was coming back out of time after time despite dose adjustments, and nobody could really figure it out. Went in his room on some routine task and saw a large pill bottle on the dresser. Turned out to be an herbal supplement containing, among other things, garlic, ginger, and IRC ginseng, all of which interact with warfarin to make it more effective. Guy's wife took pills home. Guy lectured on please run, even OTC meds past your doctor cause you absolutely did this to yourself. Labs normalized. Story 15, obligatory, not a doctor. I'm an optician and optometrist, and so many semi-blind people refuse to get glasses because they don't want to spoil their eyes. They come back 6 months later with migraines and complain about not being able to drive in the dark or read, and get angry because their eyesight is not getting better, although they're always training their eyes. It doesn't work like that. Story 16, nurse here. The condition was not worsened by the patient himself, but his choice of life partner certainly did not help. Patient Wad utterly ravaged by advanced cancer. Several doctors have told him and his wife that his condition is terminal. Patient seemed to understand when he was lucid. Wife said she understood as well. He was in hospice for comfort. One night, he had trouble breathing, as the dying tend to do. Wife called 911 against patient's wishes. Thus began a 3-week, pointless, and painful ordeal that involved life support, dialysis, at least 1 round of CPR on a man whose bones were riddled with metastasis and diarrhea. Wife was adamant that he will get better through holistic medicine. On top of being in denial, she was dumber than dirt. She filled the intensive care room with all sorts of new age chalkies like inspirational pictures and rocks. She even refused pain medicine because it would dim his chakras. Wife left a crystal geode on the bed. Crystal worked its way underneath patient's hip. Patient developed a raging bed sore that never closed, was nearly always soaked in feces, and was a dress on a patient who wanted to die and was in already excruciating pain. This was years ago. Still, I can honestly say I hate that woman. Story 17, my wife nurse has seen on more than one occasion a person on oxygen for emphysema blow themselves up with a cigarette. She said, sometimes it's funny, like Wile E. Coyote funny, and they're not injured, but sometimes the injuries are quite severe. Story 18, had a patient come in and had accidentally stuck a chainsaw on his leg the day before. He managed to cut the fibula, I think, and partially cut the tibia. He put some diesel on it and wrapped it in duct tape and kept working. The next day, he steps off something and it snaps the rest of the way through. Came in the front door with his leg flopping, bending where it shouldn't be. And to top it off, he rated his pain at 610, tough old man. We admitted him to ortho to clean out the diesel and necrotic flesh. Story 19, if my doctor was here, they'd say me. I put up with appendicitis for 56 days before going to doctor. I couldn't eat or sleep, was in constant pain, vomited multiple times an hour, but just thought I was ill and be fine in a couple of days. Long story short, I went into cardiac arrest as it exploded mid-surgery. I shouldn't have even been operated on, but a slot opened up. If not for that, I would have died in my hospital bed. So yeah, pretty much killed myself as I thought I'd be fine. Had to spend a week in hospital for a routine operation. Story 20, when I was on medicine ward in med school, we had a patient with a Zenker's diverticulum. It's essentially a weak spot. Is his esophagus. Kind of makes an outpouching where food and liquid get stuck. He can then regurgitate the food and aspirate, leading to pneumonia and other bad stuff. We were the primary team, and SURG was going to take him back to the OR on Friday. Thursday night, he eloped, and no one knew where he went. He came back Monday to the ED and got readmitted. When we asked where he went, he said there was a big food festival that weekend that he didn't want to miss, so he went. Instead of getting the surgery he left to go eat fatty and thick fried foods, which literally could have killed him. Story 21 had a patient with stage 0 breast cancer. Decided not to get the lump taken out and instead pursued traditional Chinese medicine. Came back a couple years later with metastatic breast cancer everywhere. Another patient treated her breast cancer with coffee enemas. Spoiler alert, it didn't work. Story 22, not stupid, but just plain confused. Grandpa admitted for pelvic distension, pyelonephritis, and UTI secondary to urinary retention. Urologist places a Foley catheter in to relieve his bladder and drains 3 gallons of urine in one sitting. Grandpa gets a good day's rest, and all goes well, until one night we find him standing, but naked in the middle of his room with his penis oozing a pool of blood at his feet, and the catheter with the balloon still inflated clutched in his fist. He had a very calm, "What are you all looking at?" expression as we reacted in horror. His nurse quickly calls the urologist again, and he places another Foley catheter with orders for continuous irrigation and to transfuse a unit of blood. Kept him longer in the hospital than he really needed to be. Story 23, my mom's current has oral and throat cancer. Guy literally has a stoma and no tongue. Was still smoking around 3 packs a day until recently. MIL got diagnosed W stage 3 lung cancer, quit smoking and drinking for a couple of months. As soon as doctor said her condition was improving, she went straight back to smoking, partying. Only took a few months for the cancer to get to stage 4 and spread to her liver, kidneys, and brain. She smoked up until a couple days before she died, and even then only because the brain cancer caused her to lose control of her limbs, and she physically couldn't hold a cigarette anymore. It was so sad to watch. AM incredibly proud of my husband, though. He quit smoking with her to help support her, never started again, even after she did. Said he never wants our girls to have to go through that with him. Story 24M, D here, had a patient who was found unconscious and taken to our hospital. Turns out he was diabetic unbeknownst to him and went into a coma. We got him straightened out and sent him home with insulin. Fast forward a week or two, and he comes into the ER for vomiting, dehydration, and blurred vision. He hadn't been taking his insulin since only really sick people need insulin. Story 25, not a nurse, but close. I'm a therapeutic radiographer, use radiation to treat cancers. We tell patients to be careful with what products they use on their skin because it can react with the radiation and give awful side effects. We had this one patient who was a total hippie. Probably would be an anti-vaxxer if we were in America. Anyways, she was having breast treatment, and within a couple weeks, we had noticed her skin getting really burned and breaking. We asked her whether she was using anything on her skin. Right at the beginning, we told her only to use simple moisturizers and to ask us if she wanted to use anything else. She was like, "I am glad you asked." She pulled a pamphlet out from her bag that was about this miracle oil that supposedly treats cancer. She had been slathering it on every day, and because of this, the radiation was making her skin literally fall off. We told her to stop using this immediately, and that if she wanted to use it, she'd have to wait until after treatment. She got all heated and started telling us we were a product of the system, and we didn't want her to actually be cured of cancer by this oil, because then we'd be out of a job. She stormed out. The next day, we saw her handing out these pamphlets to every patient that walked into the department. She was refusing to continue with her radiotherapy, claiming that we were only harming her and the oil will cure her. We had to get security to her out and get her doctor to sit down and talk to her. We then had to take the pamphlets back from our patients and give a big PSA as to why what she was saying was bullshit. We never saw her again. Story 26, ITT. You just have to keep reading in order to purge the previous stories that made you recoil. Eventually, you'll get to a point where you come to a story that doesn't make you flinch as much as the others. Quit then. Story 27, obligatory, not a doctor or a nurse. One time I went to the doctor for a terrible headache that had gone on for days, without break, was there right when I woke up in the morning. I got put on some drugs, went home, took them for a few days, no improvement. When I went back to the doctor, he asked how many I was taking. I said the maximum dose listed on the bottle. He said a side effect may be headaches. Story 28, contact lens wearers. Please do yourself a favor and take out your contacts when you're told to. I had a patient who came in and she thought she scratched her by taking her contact out. When we looked, she had a gigantic ulcer on her. Yes, like a canker sore that you get on your mouth can be on your eye. Ulcers, if deep enough, will eventually scar. Depending on where the ulcer develops, will determine if there's any long-term damage done. I would say if the ulcer was about 5 millimeters to the left, the patient would have lost some of her central vision. She already had 5 ulcer scars in that eye and 8 ulcer scars in the other. This was not her first rodeo. Turns out, she sleeps in her contacts every night and throws them out about once every 3 months to save money. A year's supply of her monthly contacts was 120. That one office visit alone was about 100 plus about 200 for a tiny bottle of medication to treat the ulcer, not to mention a copay for her follow-up visits. Of course, she has no backup glasses and obviously can't wear the contact with an ulcer, so she also had to pay to get a quick pair of glasses made. About another 400 setback, contact lens where time is not set to make more money for the eye docs. Your eye will literally develop a sore to tell you that it needs to breathe. Please help out your eyes. Story 29, we see a lot of people who get a common rash like eczema or some other unspecified dermatitis who very sadly convince themselves that they have bugs or worms or other creatures in their skin. They dig at their skin, pour bleach on themselves several times a day, or even cut themselves into the skin to try to dig these non-existent parasites out. In doing so, they hurt, sting, itch, and suffer more. Some isolate themselves from family and friends, fearing they'll spread a non-existent infestation. It's sad. Edit, just want to clarify that Ekbom's disease or delusions of parasitosis need not be meth, also associated with hypochondria, anxiety, depression, ECT. Story 30, homeless man came in the ER with a small cut on his scalp. Doc stitched it up, but he went back to sleeping in the gutter. Never came back for his checkup a week later. 6 months later, he showed up with an entire colony of maggots living under his scalp. Story 31, when you have your wisdom teeth extracted and the surgeon tells you not to smoke or drink with a straw for a couple of weeks. They really aren't kidding. I got what they call dry socket, which really hurt and required packing medicated gauze into my new mouth hole for a couple of weeks. 0 stars, would not buy again. Story 32, a woman who I was taking care of in labor was having heartburn, and she was sucking on a Kiki's to get rid of it. However, she was also sucking on the gas and air at the same time for pain relief, and she sucked so hard that she choked on the Kiki's, and we had to call a code blue because she couldn't cough it back up. We eventually sorted her out, and she was okay, and went back to laboring. She did literally exactly the same thing 10 minutes later. Had to call a code again. This was one of the times I really wanted to be able to tell a person that they couldn't take their baby home because they were too stupid to be allowed to have children. Story 33, grandma was in hospital for heart surgery, sharing a room with a guy who was waiting for a lung transplant. Guy is out on the balcony having just one last cigarette when he was supposed to have quit months ago. Transplant surgeon comes in, sees guy smoking on the balcony, doesn't speak to him, but leaves, takes him off the transplant list, and kicks him out of the hospital. Story 34, neither a nurse or a doctor, but this is about my grandfather. He had to have one of his knees replaced being in his upper 80s and all, but was in great health otherwise. When they did the surgery, there was an issue of him not having enough blood to circulate, so he needed several transfusions. The doctors weren't really sure why this was happening. It turns out he and my grandma had gone a couple days before to donate blood. Story 35, it pains me to see diabetics eat foods that make their condition much worse. I think part of it is denial, but the other part is that diabetes can be silent for so many years. Blood sugars can be very high and causing terrible damage to several organs, but have no symptoms. Also, people with heart failure with symptoms of severe lower extremity, swelling from bad circulation, and they don't seem to get that all the salt they eat can make it worse. Then they go against medical orders and continue to eat high-salt foods. Don't elevate their legs because it's not comfortable, etc. I has my ankles swell up after a 12-hour shift where I ended up standing more than walking, and it freaked me out to the point that I asked for an EKG. I immediately started wearing compression socks and watched my salt intake. We have only one body on this earth, and I plan on keeping it in shape. Story 36, ICU nurse took care of an 18-year-old who got into a fight with his mom about not letting him borrow the car that night. He got so mad he rammed his head into a wall, giving himself a brain bleed. He woke up out of surgery, and his mom had to prompt him to acknowledge the neurosurgeon who saved his life. All he said was "appreciate it." I caught him taking pictures throwing up gang signs in his craniotomy cap. Just so dumb. Story 37, I have a patient with autism whose mom tells him she can heal him with crystals, and he has a demon inside him. Whenever she tries to visit him, it's messed him up so much he makes himself vomit. So she leaves. It's super effective. Also, patients who let their dogs lick wounds leg ulcers because they think ITLL make it heal quicker. It does not. Story 38, work comp adjuster here. Had a claimant completely disappear after surgery was ordered. Fast forward 2 years, and he gets an attorney who demands the surgery be approved now. After months of back and forth, we approve the wrist surgery. 2 days post-op, the police find him walking down a county road, blasted out of his mind on meth, ripping out his stitches. Apparently, he went on a meth binge and just tore apart his surgical site. Doctor dropped him, his attorney dropped him, the state basically closed his case. The last I heard was he got out of jail, grabbed all his meds from home, and disappeared again. Never followed up with the doctor. I cringe to think what his arm looks like. Story 39, I don't consider this all that crazy, but it happened a lot, so I want to warn people against it. I used to work in the ED and would occasionally see patients who had had a bad fall several days prior and had hit their head. Rather than go to the ED immediately, they usually choose to treat their ensuing headaches with a painkiller. The older generation seem to prefer aspirin. The thing about aspirin is that it is a blood thinner, so what would have potentially been a small concussion was then a life-threatening and often life-altering condition. Don't treat pain with aspirin. Story 40, basically smokers in a nutshell. I work in ER, and 80 of people gasping for breath smell like an old bar with yellow nicotine stained fingernails. If you want to breathe, don't smoke. Story 41, recently had a patient with diabetic neuropathy, numbness, tingling pain in your feet. Because unchecked diabetes ruins your nerves with time, pour hot honey all over his feet. Because he thought it would help, he ended up having third-degree burns all over his feet requiring multiple skin grafts. Needless to say, he still has neuropathy. Edit fixed a typo. Story 42, me. I knew all of the signs and symptoms to look for and would have told literally anyone else to haul their ERA. But because I'm a stupid, stubborn, I ended up mostly dead. I wrote a TFU about it, which got rejected as it wasn't my fault. When yet, the extent of the damage actually was from me being an idiot. I'll paste that text below. TLDR, thought I had the flu, but ended up in intensive care with septicemia and failing kidneys. The treatment for that flooded my lungs. It sucked. The story I'm about to tell began exactly 1 month ago yesterday, but events made it impossible for me to document it for your delectation at the time. So, without further ado, it was Valentine's Day, and I was sick. Fever, chills, fatigue, nausea, and general misery had kept me home for the day. I'm in the medical field myself, and it seemed that the entire region was currently decimated by this year's influenza strain. So no biggie. That weird twinge in my side that started a few days ago was probably a pulled muscle from too many back stretches at the dance studio, right? I had shrugged it off, but now it legitimately hurt with every step I took. Fine, I'll go to the stupid clinic today, but later, first I need some more sleep. I woke up with barely enough time to fling myself out of bed and toward the hall bath, getting there just in time to vomit more fluids than I thought I'd deconsumed. Also, I noticed the lack of the coughing or congestion that typically arrives with the flu, so maybe there's something else going on. That pain is right over my left kidney. But it's probably nothing. Okay, then I should probably get my pukey to the nearest urgent care clinic, and I definitely shouldn't be driving. I call husband and explain the current circumstances, asking him to come home and take me to the doctors. Because I'm a stubborn paramedic who hates it when people go directly to the hospital's emergency room for ridiculously minor things. I went to an urgent care clinic near my house. I expected to have a PA confirm my self-diagnosis and tell me to tough it out with Flonase and Mucinex, because treating a virus like influenza usually means managing the symptoms and trying to decrease the discomfort. The PA took a quick look at me and told me to go to the ER. As is my wont, I protested, but she was serious enough that I was actually considering going. I finally agreed to go just to make husband more comfortable with the situation, but I fully expected that this was a waste of time and hours of my life I'd never get back. By the time we arrive, I've accepted that I have pyelonephritis, a kidney infection, but still feel the ER is overkill after triage and a preemptive blood draw for labs. I was taken to a room. I didn't even have time to change into the stupid, drafty, bearing gown provided before my nurse arrived to start a saline drip to treat my dehydration. Cool. Pretty standard stuff so far. Several minutes later, I was talking with the physician about my signs and symptoms when there's a perfunctory knock at the door and a lab tech enters to hand deliver my test results. Oh, this can't be good. I watch her eyes widen as she reads the CBC values, and then she announces, Yeah, we're going to be keeping you overnight. She then orders a second 4-line, hardcore painkillers, and a massive dose of 4 antibiotics, and leave me trying to figure out what just happened through a pain and narcotic haze. Well, okay. It is around 8 in the evening at this point, so overnight observation seems reasonable. I expect a patient transport tech to come fetch me and take me upstairs to a general medical ward. Instead, an RN starts to wheel my bed towards the elevator, which is really weird. Nurses usually have better things to do than move patients between wards. At this point, I hadn't been told anything about what was wrong or where I was going, but I start to get somewhat nervous as I'm moved into an intensive care unit. I rationalize this by telling myself that they must be out of general med-surg beds, and so I'm being put into this room as overflow. It's a huge room, and my nurse appears to have only one patient. Man, this keeps getting weirder. Within minutes, I'm hooked up to every type of monitor I've ever attached to a patient, and then some. Plus, I've got a transmitting cardiac telemetry monitor stuck to me. 2. My nurse goes through the endless list of health history, lifestyle, and medication questions, and asks husband to bring my birth control pills from home. I have pyelonephritis, and this is ridiculous. Is that really necessary? I mean, you'll be home tomorrow. She looks at me with both amusement and pity, and then continues bustling about the room, doing important nursing tasks. Yeah, I was wrong. It wasn't the flu. She shattered my last layer of denial by showing me my lab results, and holy my white count is 2877. I am dying, and normal white blood cell value is between 3 and 10, and I was so far past that I was in critical condition. Turns out I was in septic shock in addition to renal failure and septicemia, and had I waited a few more hours to seek medical help, it'd probably been toast. Even I couldn't deny the seriousness of the situation anymore, but I just felt too shitty to even care. After a sleepless night and an endless parade of nurses, CNAs, phlebotomists, X-ray imaging techs, and a priest, I finally meet my attending physician and a whole crew of residents. I'm exhausted, grumpy, and in pain, but apparently I still need to be lectured on how dangerously close to death I'd gotten by waiting to seek help, despite the fact that I had practically zero reason to suspect so. Anyway, afterwards we have a nice, round-table discussion of my treatment plan, how the antibiotics are working, and about how I'm probably going to be just fine in a couple days. Wrong again. Turns out the massive infusion of fluids and treatments to kickstart my kidneys caused my lungs to fill with fluid, resulting in a condition called ARDS, in which, well, you can't breathe. The alveoli, those little sacs in your lungs that do the CO2 oxygen exchanging, were effectively flooded, meaning that no matter how much air you're gulping in, you simply can't extract the amount of oxygen needed to live without medical intervention. I really didn't want to end up intubated with a ventilator breathing for me. And my awesome attending let me try the less dramatic option of diuretics and staying awake to remember to breathe. It sucked. Seriously, the worst, most miserable experience I've been through. But it worked, and on the morning of day 5 in the hospital, I got transferred to a general medical ward. It was blessedly quiet, at least until I dozed off and my oxygen sats would drop again, and then the monitor would shriek me awake. I was slowly weaned off of supplemental oxygen over the next days, and eventually got to go home on the condition that I sleep with a little extra oxygen at night. The scariest thing about the whole experience was how it snuck up on me so stealthily. Our working theory is that I must have had a completely asymptomatic UTI that progressed to my kidneys, but we'll probably never know for sure. I mean, UTIs aren't generally subtle, and if ID even suspected I had one ID have gone to urgent care for UA and an antibiotic script, I knew what to look for, and it still nearly managed to kill me. I'm fine now. Feeling much better. I'm definitely still tired and lack stamina, but IDs say I'm at about 85, and it shouldn't be too long until I'm as completely healthy as I'm likely to get. I may have lost some kidney function, so we'll continue to go in for routine blood tests, but we're very optimistic about how the most recent scans looked. TLDR thought I had the flu, but ended up in intensive care with septicemia and failing kidneys. The treatment for that flooded my lungs. It sucked. Oncology nurse here had a patient with a relatively treatable cancer fail to tell us about an herbal cure that his son bought for $300 a bottle. He was taking it while getting chemotherapy. He wound up basically shutting down his liver and kidneys, hospitalized for weeks, and delaying treatment. So, yeah, the cancer spread, system 2 weakened to resume treatment, he's dead, and all because of the snake oil cure. Sad that families spend hundreds to thousands of dollars out of desperation and wind up causing more harm death. That promote these cures for profit need to be sued. Almost all the patients at my mom's dialysis job, they eat whatever they want and skip treatments and don't understand why they feel like Story 43, well, this gives me the chance to talk about a very tragic case. I'm a geriatrician, or as my 6-year-old son likes to say, an old people doctor. Well, one day, a very fit 94-year-old lady walked through my door complaining of episodes of dizziness and lightheadedness. Since she was still living on her own and was relatively independent, our nurse specialist sat down with her to review her life so they could give counsel on what help she would need, which things she could still do independently, and what things she should avoid doing. Surprisingly, she told the nurse that she was still doing all the cleaning in her house, including getting up on a small stepladder to clean her windows. Not surprisingly, we strongly urge her not to get up on ladders anymore, given her episodes of dizziness. 2 months later, I learned that she was admitted to the hospital after she fractured her hip when she fell down from the stepladder while cleaning her windows. After that, her condition deteriorated quickly, and she died not long after that. Story 44, ophthalmologist here. Once we treated a patient who had a very severe corneal ulcer in his right eye. We tried everything to treat the ulcer: antibiotics, acyclovir, antifungal eye drops, everything we could. The ulcer would not heal. We asked the patient if he was using any other substance in his eye, such as corticosteroid drops, ophthalmic anesthetics. We explained to him he could never use this kind of eye drops for his condition because they could make everything worse. He would always be empathic, saying that he'd never do such a thing. We then scheduled a corneal transplantation, even if it was a risky procedure, but it was the last chance we had. Then one day I was talking to him, and he seemed very confused about the eye drops and their pathology. I asked him to show me all the eye drops he used to explain the pathology one by one, and then he takes a bottle of ophthalmic anesthetics from his purse. I asked him how long he had been using those. He said that since the beginning of the treatment, he started using them to get rid of the pain, which means he's used those drops for basically 8 months, every day, 4 times a day. I asked him why he did that, even after we warned him not to do so. He said, "I thought you guys were exaggerating. Because of his crazy anesthetic use, he made a very simple corneal ulcer become a very severe one. His eye ended up having a perforation after that, and a corneal transplantation was performed. After the surgery, he stopped going to our service. So who knows what he's doing to his own eye by now.